So good evening, everyone, and thank you so much in this boiling heat for getting here, which is a sure sign of your commitment to the work, which we knew already from the Eventbrite kind of selling out within seconds. And then Will and Helen and I, who are working on this project, I think spent night and day trying to kind of work out how many people we'd be able to fit in. So that's a really fantastic start. My name's Nikki Crane. I'm leading this Culture, Health and Wellbeing initiative for Southwark Council, along with my colleagues, who I'll introduce properly later. But first, to open this event and set out the Southwark stall and the context are Councillors Evelyn Okoto and Rebecca Lurie, and they're going to introduce themselves. Thank you both. So you've got one each, there you go. So we've got a chat.
Thanks, Nikki. Thank you, Nikki. So I'm Councillor Rebecca Lurie. I'm Deputy Leader of the Council, but I'm also the Cabinet Member for Culture, Leisure, Equalities and Communities. So I want to start by thanking you all for coming this evening, and thank you very much to the Tate Exchange for hosting us. It's really great to be here in the Southwark Room, which was funded by Southwark Council as part of the ambition for a community-focused building. We're here this evening to launch the first ever borough-wide approach to culture, health and wellbeing, which is really exciting for all of us. Whilst other councils continue to cut their funding for culture, it's really great that in Southwark we're committed to continuing to invest in culture. We're really lucky in Southwark that we have a really ambitious cultural strategy. And our cultural strategy sets out that everyone has the right to a high quality cultural offer, regardless of their background, knowledge, skills, needs or experience. There's also an important role that culture plays in supporting health and well-being. It can make us feel happier, boost self-confidence and self-esteem, and help us to connect with others. Over the last year, over 500,000 people have visited and participated in over 1,700 events and activities across Southwark. And working with our commissioned organisations and partners, we've supported young people in after-school activities, vulnerable adults with long-term physical and mental health issues, and older people as part of the borough programmes. We've also seen over 160 outdoor events and over 50 street parties, which have helped to bring our communities together. I'm really delighted that we're also launching our mid-term cultural strategy review, and in this paper we're going to set out an even more ambitious approach to celebrating culture across the borough. As part of that, we've also had the opportunity to become a cultural compact, which will allow us to further elevate our ambitions and allow us to work really closely alongside our neighbouring boroughs to celebrate the amazing cultural offer that our residents have access to, not just here, but in all of the surrounding boroughs as well. The review that we're undertaking is going to focus on 3 themes. So the creative economy, creative growth and creative people. And the key thing bringing all of these together is the ambition to have culture as part of our daily life. So I don't know how many of you know the Sow Gardens estate, but there is a huge piece of public art that is on display there, and that is our ambition for all of our estates across Southwark. And it's not just about Southwark going out and making art and culture accessible on all our estates. We also want all of the developments in Southwark to take the same approach. So any new developer that comes into the borough and wants to build a new building here, I want to see a piece of the borough art collection or them commissioning a Southwark artist to have a piece of art or something in their foyers or in their lifts or somewhere in a publicly accessible space that means we can really talk about the culture that's really important to the borough. And I'm really hopeful that that review is going to bring forward lots of really new ideas and opportunities to take culture out to all of our residents and to bring benefits to everyone across the borough. And I hope that that will feed really nicely into the cultural health and wellbeing conversation that we're having alongside it as well.
Thank you, Rebecca. Oh, is this on? Oh, can you hear me? Okay. So my name is Evelyn Okoto. So I'm the Cabinet Member for Community Safety and Public Health in Southwark. Now, culture is one of the most vibrant cultural quarters in the world. From our renowned healthcare institution, quick change, healthcare institution, King's Health Partners, Guy's and St Thomas's, King's College Hospital, SLAM, and not forgetting the various voluntary groups who are working tirelessly to help residents. We also have a vibrant, world-class performing and visual arts. History and heritage from the Shakespeare's Globe to Peckham Theatre, community cinemas to cutting-edge contemporary art. And obviously, we're in such a beautiful building. Southwark has it all. So why the link? There's an increasing evidence that participation in art and culture has a positive impact on people's health. It can improve mental health and well-being and bring communities together. I think about the wide range of art forms, including film, dance, music, art, and literature, and the positive feelings it gives. And if you think about it, when you go out to see a movie or you go to, a dance, the kind of relaxing feeling you have and the feeling of joy after that. But this has to be something that is accessible to everyone. And this is an area we need to utilize to make sure that health is linked in closely with culture. Now, Southwark has a vision, a fairer future vision. And one of the vision is to have a healthy borough, to reduce health inequalities, where your background doesn't determine your life chances. And this is very significant. And why is it significant? Because many people think the arts, culture, is relegated to a certain group, certain class, certain wealth. And this is something we must challenge, and I trust everyone here would do just that. So to aid this, we have commissioned Nikki Crane to oversee what will be a 5-month process to create a partnership by December 2019 to eventually develop a targeted culture, health, and well-being program in Southwark. And my dream is to make sure that culture is accessible not just to older people, but to young people, to allow them to experience, to raise their ambitions, to raise their aspirations, to be able to go to places where they never envisioned to go. I mean, Rebecca talked about some of our estates, some of our young people don't actually venture out. We have to ensure, and I hope that what we're going to develop now is to ensure that this is accessible to every single group, class, race in Southwark. And so I gladly hand over to Nikki Crane. Thank you.
Just a little bit of housekeeping before we go any further. We would like to record this evening's session. This is very much about collaboration and working together and learning what happens and what we say to each other in these sessions. So I hope that's all good with everybody. If anyone's uncomfortable with not being recorded, please let yourself be known. And at the back, Jen is sitting, and you can distinguish yourself with one of those beautifully aesthetic-looking orange lanyards, and we'll make sure that we don't record you. Thanks very much. So thank you to you both. That was a fantastic start to the evening, and you've done some of my work already because you've already laid out some of what we're going to be doing. First of all, I wanted to say a huge thank you to Tate Exchange. Obviously, being here is a great privilege, but it's not just about tonight, because we're talking to Cara, who's going to be talking to us in a minute, about an ongoing relationship. And I don't want to bring any obligation there, because we've only just started discussions, but we're already kind of bearing down heavily and saying, could we hold meetings here, or could we at least talk to you about what might happen? And so that's absolutely fantastic. Before I go any further, I wanted to introduce my colleagues I'm working with, because it's not just me doing this work. So Helen Shern at the back, can you put your hand up, Helen? Many of you will know Helen from being the head of mental health strategy, art strategy at South London and Maudsley for many years. And what Helen doesn't know about what's going on in this borough is probably not worth knowing. So it's so fantastic to have Helen on board. She knows so many people. It's just ridiculous. And Will over there, Will Nicholson, who we work together a lot at Guys and St Thomas's charity. And Will does a huge amount of local community engagement work. So something going on in the background there. So we're delighted to be working in Southwark. We live here, by the way. We live in Southwark or in the surrounding areas, and we've been working here for many, many years, either delivering strategy or working on the ground, engaging with communities. So it feels like a natural progression. And the ambition for this project, as our councillors here have suggested, is that we want to mobilise a strong and diverse partnership that will work together to make Southwark the #1 borough for innovative policy, practice and community engagement in culture, health and wellbeing. So, that's quite an ambition that we're setting out here, and we've got 5 or 6 months to kickstart the process. So this exciting piece of work is jointly commissioned by the culture and public health teams at the council, which I think is incredible, because often you're in the culture team, which is fantastic, but then you're not really talking to the health teams. And I'm working at King's College at the moment with my other hat on, and that's jointly sponsored across arts and health as well, and it makes a huge difference having that joint sponsorship. So our job over the next 5 months, as we've already said, is primarily twofold: create a partnership to develop and oversee a targeted culture, health and wellbeing programme in Southwark that delivers maximum impact for residents here. And we hope that this initial project, because that's what it is, will kickstart a 5-year culture, health and wellbeing programme that will deliver against the council's public health priorities and, importantly, be embedded fully in the cultural strategy. So this is the first of our events. It's the beginning of a conversation, which will be followed by lots of other key opportunities to get together. So Will, Helen and I will be forming focus groups to bring you in. We want you to identify yourselves, because this is about partnership. It's about the time you've got to give to this, and we're talking about action here. So we're very impatient people. We're not going to be sitting behind a massive desk research piece, although we'll be doing that as well. We want you to come to us. You have our email addresses. We're out there in the domain. Please say we want to work in partnership. And the great thing is we don't know what that partnership looks like at the moment. But that partnership will drive the programme that we begin to outline between now and December. And the idea is that the partnership will then take ownership of that programme. So it's just our job to be the catalyst for that. We've drawn together tonight. I'm absolutely awe-inspired by the people we've got here. They're going to introduce themselves to you in a moment. And I'm so delighted because this signals the potential partnership nationally, regionally, and locally that we can make through this work. And these people, like you, are also incredibly busy and have given up their time and travelled a heck of a long way to come and talk to us about the arts and health out there, the field that is in the ascendancy at the moment. I'm sure you're aware that there is no moment like this for arts and health. And as these people speak, I think you will underline, I'll be very surprised if you don't, that the stars are aligned now for this work to really take off. So if we don't do it now, we'll have lost the opportunity. So I'm going to stop speaking now, and I'm going to come back at the end. I can see that Kevin Fenton has joined us. Hi, Kevin, who's going to be speaking later. Do join us at the front when you want to, which is absolutely fantastic to have Kevin Fenton here. But in the meantime, one of our other great speakers to tell you a bit about Tate Exchange and their involvement here locally is Cara.
So, firstly, welcome to Tate Exchange. This is Tate's platform for socially engaged, very deeply participative work. There's a lot of really familiar faces in the room today. And of course we're in the Southwark room, as you mentioned, not just funded by the council, but really named in recognition as well of the huge support that the council gave in setting up Tate Exchange. And it was a 16-year conversation to get Tate Exchange in existence, and as we see it now. So it's in no small part with the council's help for making that happen too. Since we opened just 3 years ago, we've worked with numerous organisations and individuals from across the borough, and we work with associate organisations who are our partners over a long period of time, not just a splash sort of project relationship. Pen People, Peckham Platform, the Feminist Library, Maudsley that was mentioned earlier, Latin Elephant, Community Action Southwark, Digital Maker Collective. I'm sure there's some in there that I've going to miss as well, but I saw Flourishing Lives in the house somewhere. There you are. And also we work with Public Works, which is the associate that is in the install for their programme that's going to open with us tomorrow, but who are also working on a project in the borough as well. So I think to reiterate some of what's been said already to preface this conversation, but also to really frame it in the ethos of Tate Exchange, there's three things which I think I'd like you to be mindful of as we go through this evening. And taking our cue from Flourishing Lives again, they've really helped us take an approach to health and well-being, which is about flourishing. And it's about asking, what can we do to help people not just survive and get by, but really flourish, no matter what life stage they're in, and what, through all aspects of their lives. So what does that mean for Southwark? What does that mean for the room here, the communities that you work with and the individuals that you know? Secondly, Tate Exchange is a space where people come and talk, and they share their life stories, their life experiences, and the lived experience of every day is the stuff of our conversations. But it's also a space that has a really explicit call to action. And we look at what happens when art and society come together, and behavioural change that might come out of that as well. And I put that call of action really back to you as a group to be committing to that what next from this evening too. And then thirdly, Tate Exchange is a space that is this microcosm of people from all sorts of backgrounds and ages and places and everything, and from all different sectors that we work with as well. And they come together and they collaborate. And we're forming this really lovely community of practice, which works across sectors and it works across art forms. I think in this room there's a massive potential for those similar exponential benefits to come from the joining of the many in this room, and spurred on really by what everybody has in common here, which is a passion for the local. And it's amazing to see so many people here today. Lastly, some of the really exciting stuff. No fire alarms are expected. If there is one, just follow me. Wi-Fi, you can log on to, it's just Tate or Tate Exchange Wi-Fi. We don't ask for your data unless you willingly want to give it to us. Toilets are out of this door, cross past the lifts, right and then right again through the double doors. And absolutely, really strictly, we have to be out of this building by 8:30. I don't want anybody to take on that conversation with the security guards, so if we can help each other to get out by 8:30, that would be wonderful. Until then, and in the meantime, have an amazing conversation. Thank you.
Okay, that was strongly put, so we need to stay to time. And I'm going to hand over straight away to Alex Coulter. Alex provides the secretariat, and I must say much, much more than that, for the All-Party Parliamentary Group, which I hope you'll forgive us calling it the APPG, All-Party Parliamentary Group on Arts, Health and Wellbeing, and I'll leave her to explain further, and then I'll introduce the rest of the panel. Thank you, Alex.
Thank you very much, Nikki.
Yes.
Thank you very much, Nikki and Will and Helen, for inviting me this evening. It's fantastic to be here and hearing about everything that's going on in Southwark. Everything is always going on in Southwark. And I am here, as Nikki says, on behalf of the All-Party Parliamentary Group on Arts, Health and Wellbeing. My day job is as Director of Arts and Health Southwest, which is a regional learning, advocacy, networking and development organisation. And we also have Jenny here from London Arts and Health Forum, and both of us are involved in something called the Culture, Health and Wellbeing Alliance, which I hope most of you are aware of. You can sign up for free and receive regular bulletins which give you updates on national developments and the work of the APPG. You all have a copy of the short report on your chair. Some of you may have several versions of this short report. You also, probably some of you know that in there is a link to the main report, which you can download online. And this report was a result of a 2-year inquiry that involved over 300 people from all over the country coming into Parliament to speak at round tables on a whole range of themes. It also involved a call for practice examples, which elicited over 200 from across the country, and there was an evidence review and desk research backing it up. So the main report is full of evidence and practice examples. And the main report is underpinned by the social determinants of health, an approach to thinking about this work in relation to the social determinants of health. So I thought it was quite interesting in the introduction that that also is the way that you might be considering this partnership in Southwark. Nikki was involved with the inquiry through her work with Guy's and St Thomas's charity. They were the practice partner. Dr. Rebecca Gordon-Nesbitt, who drafted the report for us and did the background research, was based at King's College, and so they were another partner. And a lot of the practice examples in the report came through those routes and are from the patch that King's Health Partners covers. And in fact, in the short report, one of the case studies on page 7 is of Creative Families, which is South London Gallery, work with new mothers who have mental health challenges and how to work with them and their babies. And as I understand it from Helen, that work is still going on. I wasn't sure, because one of the problems we all have, as you know, is the short-termism of project funding, and I didn't know whether that project was still continuing, but I'm very pleased to hear that it is. But how to sustain the work, how to embed the work, how to find sustainable business models for the work is really critical at this stage, and it's a fantastic opportunity that you have this Culture, Health and Wellbeing partnership, because it really does have to get more strategic. I think that is where we have to go next. We need to have those partnerships working at a strategic level, and that work will eventually become more embedded in the day-to-day delivery of health and care, and also contribute to what, as Nikki said, I think, which is the stars are aligning. And that's partly because when this report landed, it landed on very fertile territory, and I think we've met a zeitgeist around a shift in the thinking about health from a medical model, illness-based model, through to a healthy and health-creating society, and much more of a focus on prevention. So looking at the report then, it had 10 recommendations, and I was very pleased to hear that some of your thinking around this partnership is based on looking at those recommendations. And we are hearing that about that happening elsewhere. And I know you think Southwark is totally the avant-garde, but Calderdale is also doing something similar. And I have suggested you get to chat to people in Calderdale and find out what they're doing, because they now have a strategy based on the 10 recommendations as well. So the 10 recommendations are targeted at different, what you might say stakeholders, but that's not a very active name. It's really the players, the key actors in this space. And of course it is a very interdisciplinary, cross-sectoral space, and that is part of why it's so difficult to find the home for some of this work, because it really sits between a lot of different systems. And so the recommendations are attempting to influence at a systems level in various different ways. Recommendation 2 is for a cross-government strategy. And I mean, I think all of this is about integration, which again mirrors what's going on in the changes in health and social care. There has been some progress in that space. I would say the Department for Culture, Sport, Media, DCMS, you know the one, and the Department for Health have a stronger relationship in the last couple of years. And of course, Matt Hancock had a very significant impact on our work, actually, when he spoke at the Social Prescribing Conference at the King's Fund last November. And he was talking very much about prevention. He was talking about social prescribing being or fundamental to prevention, and then he talked about the arts and culture as being fundamental to social prescribing. That has really raised the game and raised the profile of the work, and was a significant milestone. Whether we'll get a cross-government strategy or not, I don't know, but you may have noticed that the recent DCMS Select Committee inquiry led to another recommendation which was similar. It was around social impact of the arts and sport, and they were recommending a cross-government task force. So I think, we may see stuff happening at that level. Developments in social prescribing are obviously a very important context for this work, and that, as I was saying, does reflect the NHS long-term plan, the emphasis on prevention and on personalised care. Social prescribing is under that personalised care banner, as many of you will know. And that does reflect a shift towards more person-centred, more psychosocial models of health and away from, strictly speaking, the medical model. And as many of you will also know, it is based on what is happening on the ground. There's lots of evidence around about 30% of people attending GP surgeries are going for non-medical needs, or they may have medical needs, but the background story is about non-medical issues. And so really we do need to look at what's going on in people's lives and try to help them in a more social context. Loneliness is obviously very high on the agenda. There's a national loneliness strategy, and the Arts Council has committed to arts and cultural organisations playing their part in that. And I think some of those people attending GP surgeries, loneliness does seem to be a recurring issue that is brought up and as a reason why. It is a very significant moment for us. As Nikki said, it does feel like the stars are aligning, and we have got to seize the moment. It's very challenging because I think capacity and infrastructure is very patchy. But it is fantastic that in a borough and in Southwark you can model a really integrated approach, and really we can take that learning and spread it elsewhere. Some other things just very quickly. How am I doing on time? Yeah. So other things around the recommendations, just very briefly. Recommendation 3 looks at trying to get champions in local authorities, in NHS trusts, in clinical commissioning groups at board level. There is some work that is developing. We're getting some momentum there. We haven't got hundreds of them, and there obviously could be hundreds, but we've got NHS providers, Local Government Association, and the Culture, Health and Wellbeing Alliance on supporting a network of champions. So that is something that any of you could pursue. You may not need it in Southwark, but if any of you have any relationships slightly beyond the borough where you think you could push for champions at board level, that would be a great help. And another thing that we're doing at the moment is working with academic health science networks, looking at how to influence, support planning for integrated care systems. I often think London is quite different from other parts of the country. I'm based in the southwest, and in a way, my thinking's often sort of the whole of Dorset or the whole of Gloucestershire and its integrated care system, and it's a slightly different conception of the territory, obviously much more rural. But integrated care systems, as you'll probably know, sit above the primary care networks, where the link workers will sit for social prescribing, and so we're trying to get some thinking into that level of strategic planning around the arts and culture. I think that's more or less all. Recommendation 1, some of you may be interested in, is about a national strategic centre. We are making some progress on that, but I don't have an announcement to make, unfortunately. Soon, yes, soon. Nikki's been involved in that too. Thank you.
Alex is brilliant at packing millions of amazing facts, every single one of them an absolute nugget, into a really speedy presentation. Thanks hugely for that. So in the interest of time, I'm going to introduce you to all 3 speakers here, and then let them run, and they could even have a conversation together, because you're all working together, aren't you, in one way or another. So Richard Ings, Arts Council England, a colleague of mine when I was at the Arts Council for many years, and Rich is leading on arts and health, well-being and criminal justice, which is a fantastic combination. As you'll know, the health justice combination is a really interesting area that I'm personally very interested in as well. And Richard's a great champion in London for us, and is advocating for all that we need doing. So that's absolutely brilliant. And then Jenny Reagan, Director, London Arts and Health Forum, we call LAUGH, which you probably don't use very much, I don't know. But so I'll get Jenny to speak a bit more about that. And third but not least at all, Jill Wiltshire, Senior Programme Officer, Health, Greater London Authority Health, the London Partnership, and Jill's been working quite closely with us talking about social prescribing, so that we join up with the GLA and the Mayor's Office and Healthy London Partnership. So do you want to stay seated, you 3, or do you want to come up?
People's vision of whether we should go over.
Yeah? You come up first then, Richard, and then...
Okay. Thanks. Thank you very much, Nikki, and thanks again for inviting us to this really, really exciting occasion. It's great to be in Tate Exchange, which does so much brilliant work. It is a moment, I think. I remember going to one of the many conferences that Alex has organised down in Bristol a couple of years ago, and I was just gobsmacked by the number of incredible projects there were, how many countries were represented there, and I just thought this has grown like Topsy, this whole scene around arts and health, because it's a moment with a history. And just briefly go back to my own personal history with Nikki, when we were working together on evaluating something some of you will remember, I'm sure, Be Creative, Be Well, which was the cultural strand of Well London. And that was interesting, and it's interesting now. This is about 8, 9, 10 years ago, a long while ago. But the kind of thesis we were working on and testing was there a link between really good participatory arts, we're now calling it socially engaged arts, we'll probably call it something different next year, but the links between that and the outcomes of that work, and what was fairly new then, the 5 ways to Wellbeing from the New Economics Foundation, which of course has been widely adopted by the NHS. And I think that argument still runs, and I think interesting comments earlier on from the councillors about the links between going to the theatre and feeling stimulated or having enjoyed yourself. At that very basic level, there's a huge link, and historically as well, of course, between arts and health. We're turning to the present. We have, over the last few years, possibly taken our eyes off the ball at the Arts Council. But over the last 2 years, I'm glad to say we've renewed our focus, particularly as we're approaching our next 10-year strategy, which some of you, I think, will have contributed to, and you still have a chance to, and I'll say that a bit more about that in a moment. Although we have always funded this sort of stuff, arts and health projects, through different programmes. We've had to get them through, in a sense, by calling them supporting the resilience of arts organisations or something. But we've had a cultural commissioning programme that some of you will know about, where we've worked with local authorities to see other things that artists and cultural organisations can do that will help you in your agendas. And often that was health and social care, which of course are linked. And Creative People and Places, Great Places, all these programmes have elements of health in them. So what have we done so far as we grind our way through the consultation for the next strategy? Well, one thing we've done is we've brought in the Culture, Health and Wellbeing Alliance that you've heard about, the national organisation Alliance, Arts and Museums coming together to form a new organisation, now part of our national portfolio of regularly funded organisations, and similarly with the National Criminal Justice Arts Alliance as well. So that's a small token, if you like, of our increasing and renewed interest in the area. We've also set up, we've identified people in all of our 9 regional offices across the 5 areas of the Arts Council that can champion this work. And John McMahon, who leads on this work nationally, keeps adding people to it. So we've got about 36 people around the Arts Council, which is a small organisation, actually trying to help support people, making applications, working with public health, with local authorities, looking at what's happening, what's developing around social prescribing and so on. So, and that is a network that's going to continue and I think will be strengthened come the new strategy. I'm aware I haven't got very much time to talk, but I think I think we've been catching up with what's happening in arts and health. And we're now starting to have, well, we've well begun the conversations that we used to have, and we've now got them again with NHS, with Public Health England, Royal Society of Public Health, and obviously the work with the APPG, which has been amazing, and the Creative Health Report has been hugely helpful. If you haven't read the long report, please read it. It's a good read, and lots and lots of good case studies in there, which are constantly being added to. So there's very briefly, there are 3 things that seem to be emerging for us as particular things that we might be able to contribute to. One is mental health, particularly mental health of young people, but not exclusively that. So we're part of the March Network, which is looking at assets in communities that might help address the mental health issues that we have as a society. We're looking at healthy ageing. We've got and obviously you might not know, but we've got a partnership with the Bearing Foundation, which is about supporting older people and working to influence care homes and so The third area, a really important one, and that is really ahead of us at the moment in terms of our own strategy. We've got to try and do something with it this year because it's social prescription or social prescribing. That is a massive opportunity. I've said at other occasions like this, I think this is a huge opportunity actually for arts and culture. Because as has been hinted before, we have a current policy which is achieving great art and culture for everyone. It's the for everyone bit that's really difficult because arts, culture have all sorts of associations with them. They're seen as inaccessible. They may be seen as elitist. Now, if your GP, your social worker, your librarian says, I think what you need, you're feeling low, you're lonely, whatever it is, I think what you need is an art class, a dance class, or you have a particular condition. Why not do this? And suddenly, I think people realise, it's for me too, and who knows where that might lead. So very quickly, I'm currently focusing on the London area work and working together with, obviously, London Arts and Health Forum, like very close relationship with them, and with the GLA, looking at the potential for collaboration and partnerships. And I think it is a question of joining forces and joining up services. That's what's behind all the moves in the health sector, I think, at the moment, to try and make sense and make a more holistic provision. Okay, so should I stop there, Nikki?
I'd love to hear more, but
Okay, I can answer questions if it's any more than that. Thank you.
I mean, as long as you're on board and you're helping us and you're staying in close contact with us in Southwark, then that's fine, Richard. Thank you so much. Thanks. Yes, very well deserved. So, Jenny, do you want to come next? Thank you.
Is everyone else? So as Nikki said, I run London Arts and Health Forum. I recognise quite a few people in this room, so some of you will know what the charity does. We're a membership organisation who supports arts and health practitioners and projects across London and actually beyond as well. I think it's been mentioned quite a lot here, but I think the main kind of thing I would take forward with this is partnership. Everything we've done so far has been about collaboration and partnership. People, particularly the practitioners we work with, have very little resources and very little funding, and so therefore the main thing we're doing is making sure everyone can kind of work together and we give them a voice. So we know that kind of in the current political climate, arts and health, can offer a really kind of cost-effective in some cases and a really kind of substantial and transformational way or addition to kind of healthcare. But I guess from our point of view, it's been, we've mentioned social prescribing, I'm sure it's going to come up a lot more. As a charity, we're very much working to make the two meet. I think arts and health still don't sit very naturally together in terms of structure, in terms of funding. Again, Alex mentioned it. Arts projects are very often, arts and health projects are often short-term, they're often funded for a very small amount of time, whereas the NHS or healthcare need long-term solutions that can be kind of scaled up and kind of given across the country. So it's kind of part of what we're doing as a charity is very much trying to bring the two together. And it's not always a comfortable marriage, but it's becoming a lot healthier relationship. So the kind of way we're doing that is, first of all, we're working with healthcare, with clinical, mainly with one area at the moment. We're hoping to kind of roll it out, and that's with Greenwich, where we're actually offering workshops and training to GPs and practice staff, many of whom don't kind of come into the room. I actually did an event last week where we had 50 people who worked at surgeries in Greenwich who had their kind of, it's the afternoon off for learning, and they all looked at me like they just really didn't want to be there. They all looked completely, nonplussed. And actually, after 2 hours of talking, of doing, we did some art, we did some writing, we did all sorts of creative activities. They left with smiles on their face, and it was amazing. And actually, they will then go into their work and realise that creativity can make you feel very well, and can also be used on in terms of people coming into their practices. So I think it was one of the things we're trying to do is really trying to show and bring them on board, which has worked really, really well. In terms of social prescribing, I think most people would agree with me, it's a really exciting time, but it's also quite a worrying time for lots of our members. In terms of, there's a lot of support there. We're at a really good stage, and hopefully, it's going to really bring up the whole arts and health movement. However, a lot of members are quite concerned that it is possibly going to be seen as something free or cheap, and the resources, haven't yet been kind of passed on down to the project. So again, a lot of work we're doing is to ensure that our projects and practitioners will hopefully know how to support themselves, and we can speak on a national level with the government and the NHS. And just finally, Alex mentioned we work very closely with Culture, Health and Wellbeing Alliance. I am the local area champion for that, and we are currently, we're very in our infancy, but we're currently trying to set up much more kind of hyper-local networks, arts and health networks in London. So there are networks out there. There's some fantastic, practitioners out there. Lots of you in the room I know do some brilliant work, and it's just really about kind of bringing them all together. And you can join CHWA, as we call it, as a member. And again, we're in the middle of setting up kind of a scoping thing of what people want from the area. So if you do want to find out more, then get in touch. Thank you.
Do join CHWA. If there's one thing you do after this event, join CHWA, Culture, Health and Wellbeing Alliance. Okay, Jill, thank you. Can you give us a whistle-stop tour, please, through what you're doing, which is mega stuff across London, the vision for social prescribing?
Hello, hi, I'm Jill, as Nikki said, and I'm from the health team at the Mayor's office in the GLA. But I don't just work within the health team on social prescribing, I work across the whole of the GLA and work really closely with the culture team on a lot of the stuff that we're doing at the moment. Just to sort of set the scene for you, and some of you will have heard this before, so I apologise. As you know, the Mayor doesn't have any statutory responsibility over the NHS, but he does do what he calls champion and challenging the NHS. So he's always keen to sort of champion what they do well and challenge what he feels they don't do so well. And one of those issues will be about whether resources to deliver activities in social prescribing are actually seen as being free resources. And we've heard some awful horror stories from voluntary sector organisations who say that the NHS treats them as a sort of a free resource that they can use at any time. And that is one of the things that we're looking to address. But over the last couple of years, as I said, the Mayor hasn't got statutory responsibility over the NHS, but he does have a statutory responsibility to reduce health inequalities in London. So in October last year, he published a health inequality strategy. And one of the main aims of that strategy is to grow social prescribing in London, but in particular for those most disadvantaged groups. So over the last 18 months, we've been working with the NHS, with the voluntary sector, with lots of different organisations, with councils, to try and develop a vision for London for social prescribing. Now, this has taken us a lot longer than we thought. Partnership working is lovely, but it's also really difficult. So getting everyone's priorities and everybody's aims and what they want to do within that. Also, during that whole process, we had the long-term plan was actually launched, where the NHS are actually funding a number of, up to 1,000 link workers in the next year. We think that will equate to about 100 additional posts in London, but we haven't quite done all the maths yet. Obviously them bringing in funding into social prescribing does make a difference to how things are funded. We haven't yet worked through how those new link workers coming in will be trained against what the training that link workers that already exist are there. But I can assure you that the message that's coming down from national and the message we're pushing really hard is that please don't reinvent the wheel. There's already fantastic projects out there that all of you are involved in. They're actually doing an absolutely amazing job. And what we don't want is GPs setting up their own schemes within their own GP networks and just doing their own thing. And we are lucky because the Mayor's Health Advisor, Tom Coffey, is a GP in Tooting. He runs social prescribing. He knows what all the pitfalls are, and he's already making lots of noises. And one of the things we are trying to do is actually, hopefully do more and lots of noises, but one of the things we are trying to do is actually get into the primary care networks. There's 204 in London, trying to get into the primary care networks at the right time, catching them at the golden time and saying to them, look, think about the voluntary sector, and this is a massive resource, but you are equal partners. So just to sort of finish, say the vision is it is coming out. I promise. I keep saying it's coming out. We hope to have it out by the end of the month. It sort of sets out the idea that the 5 pillars around that we want it to be accessible, but we want social prescribing to stay localised. We want the voluntary sector to be treated as an equal partner, and we want to actually take things forward. It also sets out a number of work streams that we have, and also what we're planning to do over the next 10 years, because this is a long-term strategy. It's the health and quality strategy is a 10-year strategy, and this sits alongside it. So it isn't just for this mayor, although I understand from his interview at the BBC News yesterday, he wants to be in post for at least 5 terms, so he says. But we are seeing this as sort of not just being for this particular mayor. But yeah, we're very positive about the future, but we do recognise that there are an awful lot of issues and things that we have to work through. Just very quickly, I just want to say thank you to Richard and to Nikki, because we recognised very early on the importance of arts and health. And I would very, very much recommend a creative health report, the full report. We use that in the health team a lot. So all the case studies and everything. So, but we did recognise that health and arts is a very important thing. It does feature quite prominently within the draft vision, and it's going to stay there. So we just thought you'd be very pleased to know that, and hopefully you'll get to see it very soon.
Okay, so amazingly, because our speakers are so succinct and they've got huge agendas to communicate, so I commend them for that, and they're making my job a lot easier. We've got about 10 minutes for, a little less than that. We've caught up some time, so I don't want to be too generous, because we'll probably lose some time as we go into the next session. So there's time for a few questions from the floor. I'm dying to ask something, but I'm going to sacrifice that. So I think, how many roving mics do we have? Do we just have 1 or 2? We've certainly got 1. Are there any questions to our panel here at the moment before we move on to the next session? Yeah?
Sorry, I work independently, running creative writing workshops for health and wellbeing, and I have not caught up really with the social prescribing situation, and I noticed that it's quite important not to expect voluntary organisations just to carry the cost. And as far as I'm aware, the only funding that seems to be around is for people to coordinate and assist people with their choice, which kind of sounds like a community work situation to me that should exist anyway. I just wondered if anybody had anything useful or hopeful to say, anybody on the panel, about the funding situation for providers who aren't, in social prescribing. So look, you're looking as though it's very familiar to you, that.
Yes. Yeah. We're all nodding. Yeah, absolutely, yeah. Who would like to answer that? Go for it. Or you can do a chorus line all at once.
You may have a sort of... there may be a London solution. Oh, don't need that. There may be a London solution, which Jill can mention, but I would just look at the social prescribing guidance, the National Social Prescribing Guidance, because it does attempt to start that conversation. And if you think about the reality, you've got multiple different sectors represented in the social prescription. There is, which Richard may know more about, the Social Prescribing Academy, which does have on its board Natural England, I think, Arts Council England, Sport England. There are a lot of different sectors that are playing a part in this, and it isn't obvious who should fund it. And I think there just has to be a partnership approach. So they recommend in the social prescribing guidance a local solution. And I have heard NHS England say that they do expect CCGs to contribute to that funding, but they can't mandate for that. They're not going to pay for it from the centre. So I just think it's going to take quite a time to sort out. But I do think there is a nugget of hope.
Yeah, so there are a couple of specific funding streams that are either open or be coming open soon. There's a Team London who run out of City Hall have a small grants programme that's currently open, and it's around social isolation and loneliness and social prescribing. Their small grants, I think they're up to about 10,000, I think. But if you have a look on the GLA website, the details are on there. So that's just one example. I know it's a small example of a programme. The other thing is that Healthy London Partnership, who I failed to mention and will get told off for that, that are our partners that we work with. They're the sort of prevention body, that amalgamation of NHS bodies across London. They do have a Healthy London Fund, Healthy London Social Fund, and actually some elements of that are focused on social prescribing, but there isn't specific funding opportunities there at the moment, but there will be in the future. But you're exactly right. Most of the guidance is about local solutions and local funding.
And I've heard about these kind of local investment pots where everyone's putting some money in. So I think it's our job to keep an eye on what's coming up and for us to communicate to you where there are opportunities, because it's something that we're keeping a close check on. Any other questions on this session? I think more water is needed.
Hello, Nick Rampley from Morley College, which is the sort of place where, Richard, you'd come and do that arts class that you mentioned. So we're very interested in the territory of social prescribing, but I just wondered how you square the circle of it being preventative. Social prescribing feels to me like something that you are prescribed when there's a problem, and preventative medicine is getting people to partake in culture and the arts to stop the problem in the first place, which is more about health information rather than social prescribing. So, are there works afoot to bring the benefits of arts and culture into the sort of health information sphere?
Yeah, very much are. And of course, the one thing I forgot to talk about just now was what's currently in our draft strategy, which is out for consultation at the moment. And it really does see social prescribing as part of a spectrum of work. And social prescribing, as you say, is prescription, and it will be for a certain number of people that don't have serious clinical conditions, but that could benefit from it. So it's a minority of people ultimately that will benefit from that. But arts and health, in terms of what perhaps is going to happen in this borough, is a much wider thing than that. So if I just tell you what we're sort of thinking about at the moment around this, I've got to read it out actually, because it's around, we've got 3 areas in our new strategy: creative people, cultural communities, and a creative and cultural country. Wouldn't that be nice? But we've got 4 priorities under cultural communities, and I'm glad to say that one of them is cultural initiatives that achieve health and wellbeing benefits for people of all ages. And there's 3 aspects to this. Consider how we can work more effectively in partnership with health, cultural and community partners to deliver culture with health and wellbeing benefits. So Healthy London Partnership was just mentioned. The first work is happening in Southwark, Merton and Camden, and I'll be working with them and the borough leads that we have at the Arts Council to try and be supportive and try and bring the arts and cultural sector into the conversation. Secondly, undertake research, consider international best practice, exploring promising new approaches such as social prescribing, and give specific consideration to the needs of children and young people and older people. And in fact, you might want to refer to a summary of evidence that we produced at the end of last year as part of part of our consultation on the strategy, just look at the evidence base and where the gaps are. So we'd be looking to support that and to make the case more strongly. Finally, very quickly, it's interesting, this one, I think, if we go ahead with it. Consider the viability of a programme that supports prototypes, small cultural experiments with measurable outcomes that could in the long term contribute to both practice and a measurement framework for social outcomes. Because we haven't always been articulate about the social value of what we've invested in. And for me, anyway, great art can produce great social outcomes, as well as great learning outcomes, as well as being great art. So, yes,
Great.
we will be.
Thank you. Just very, very quickly.
Oh,
Jenny,
no, don't worry.
no, please.
Just to add,
very quickly.
in terms of preventative, I can't see who asked the question. As I think Alex mentioned, a lot of people do see their GPs because of non-medical reasons. So I think arts and health can really provide something that can prevent someone developing ill mental health or ill physical health by bringing them into the community and by getting those connections going and by getting them involved in something that gives them a bit more life.
Could I just add one point which was raised earlier around the fact that the NHS money, the government money, is going currently into the link workers. And they're paying 100% for those link workers, which they don't always do. So they are putting quite a commitment in. But some of those link workers could be based in cultural organisations. I mean, there's a tradition. I mean, these things, it's not a new idea. It's been around for ages in the voluntary sector. So I think that's a very interesting that we're keen to explore.
Yeah, we're going to look at that, Richard, with your help, actually, locally, and see what the possibilities are. So we're going to move on now to what we're calling our local panel. We're sort of moving to a local focus. And can I introduce you please, to Kevin Fenton, who's making a spectacular entrance as we speak here. And I met Kevin first on the Science Gallery Leonardo panel. So anyway, nice to see you. Thank you for joining us. And also Rebecca Towers, and I think I'm introducing you correctly. You're you're the Director of Leisure, Rebecca. Yeah. Now, I don't know how you want to play it, both of you, whether you want to take the microphone. Meanwhile, can I invite our other speakers for the local speaking onto the table, please. So that's Jane, and Mal, and Laura, and Jill. So that you're all ready, that we can seamlessly go into the case study. So, great. I really like that. So off you go. Thank
Wonderful. So good evening, everyone. I'm Kevin Fenton, one of the strategic directors at the Council, Southwark Council, and I'd like to express my thanks to Tate Exchange for hosting us this evening and for all of you for attending. So to start this session, we're going to have an informal conversation with my dear colleague, Rebecca Towers. Rebecca, would you like to introduce yourself?
Yes. Hello, everybody. It's really great to be here this evening. It's really exciting to hear all of the developments in culture, health and wellbeing, and we're really glad to be part of that. I'm glad to be sharing the stage with my colleague Kevin to demonstrate our commitment to the partnership between culture and public health. So, like everybody has already said, I am the Director of Leisure, not the Strategic Director of Leisure, because that would be a promotion, but I'm really, really excited to look at the opportunities within the cultural sector moving forward. I think Kevin's going to ask me a question.
So I'm going to ask the first question today, which is about the opportunity for partnership in Southwark. What do you think this opportunity is, and how do we take this to the next level?
So Councillor Lurie already mentioned our Creative Southwark strategy, and within that strategy we talk about supporting programmes which will lead to healthier lives for our residents. So that's actually at the core of what we want to achieve. I think it's really great in Southwark, and I've recently been doing tours as part of my role as Director of Leisure, meeting some of our cultural partners, and I've seen some really exciting examples of projects where people's lives are, being improved, and mental health, impact on mental health is really evident through the projects delivered by cultural partners. So I know Dragon Cafe are going to speak for themselves, so I'm not going to talk about them, but I've recently heard about Breathe Arts Health Research, who are delivering a really exciting project called Melodies for Mums, and you'll notice I'm using the word exciting a lot because I'm very excited about all of this, but Melodies for Mums is a project which looks at trying to tackle symptoms of postnatal depression early using singing. Isn't that wonderful? And I recently met London Bubble Theatre, who have got a Tackling Loneliness project, a project called Rotherhithe Shed, where people are tinkering away and being together and reducing isolation. South London Gallery are doing a really exciting work in So Gardens Estate, which Councillor Lurie has already mentioned. I don't know that they call Art Block a health and wellbeing project, but I do. So it's play and art coming together, really high quality art and culture in the housing estate where people are and meeting their needs. So I think we're trailblazing. There's lots of connections already being made. I think there's more work to be done. And I think we need to be looking at mapping and seeing what opportunities already exist, looking to strengthen and improve connections, looking to find unusual connections and partnerships, unusual spaces for delivery. I'm really into democratic spaces, so I manage parks, I manage libraries, and those are spaces where people already are, and they're already doing their stuff, they're really engaged in those spaces. So can we take our culture to those people in those places and do more of that? So it's really about the benefits to Southwark residents, all of Southwark residents, and I think as a local authority we've got a really good opportunity to see the helicopter view and take a bit of a strategic view. Oh, and I'm going to ask you a question now. So how do you think we can strengthen what we've already got, Kevin, and move a bit beyond that from a public health point of view?
So I think from our perspective in health, we are always looking at the assets that we have within any community and how do we build upon those assets. And one of the things that's strikingly clear about Southwark is that we're full of assets. Some of the best hospitals in the nation, if not in Western Europe, some of the most amazing cultural institutions, certainly in London, if not in Western Europe and in the country. And certainly when you think of the diversity of our communities and the assets within our communities, whether it's people from different ethnic backgrounds, people across the life course who are connecting and engaging in different ways, these are assets that we can use. So as we think about strengthening the opportunities and taking it to the next level, I think recognizing and understanding those assets is going to be the key. Second, ensuring that we have a shared purpose and a shared vision for what we want to achieve when it comes to culture, health, and well-being. I think this field has been troubled, I think, over the years of small projects which have started and that have floundered, of a lack of sustainability in what we're trying to achieve, and perhaps not a shared vision of what good looks like or what the final mile looks like in terms of what will be different as a result of activating our communities around health, well-being, and culture, and how do we have that shared vision around culture, health, and well-being. So I think understanding our assets, having a shared vision, and working in partnership. I'm so excited to see so many of you here today because there is a thirst and a desire for us to do things differently, and there is a desire for us to have different outcomes. Whether those outcomes are improving health, whether it's addressing some of the mental health challenges that we're seeing across our communities, or tackling some of the wicked problems that we're faced with, youth crime and violence, social isolation, thinking about the epidemic of chronic diseases that we have and how can we get people to connect more, to move more, and to take care of their mental health. So I think these are some of the things that we would need to have in place to truly help to make the partnership stronger and to have a different outcome. So that's my 2 cents on this. So my next question to you is, what needs to change and where is the opportunity?
So I think I've already mentioned really the democratic spaces and going to where people are. I think, I'm not saying that has to change because I think we're doing quite a lot of that already. I've seen really great examples of culture going out into parks, events, with a really high quality offer. I think we just need to see if we can do more of that. I think culture should be for everyone. I think there's huge benefits for the diverse population of Southwark. But unfortunately, as people have already mentioned, I think sometimes cultural venues can be exclusionary and people don't feel like their space is for them. So again, we've got really great examples in the borough already of the work work that's going on, can we learn from that best practice? I think that's what we need to try and do. And can we look to see if there are groups that, or if there are geographies within the borough that are not being reached already. And so we'll do that through the mapping, we'll do that through looking at case studies, through the best practice. I mean, without predicting the outcomes of this initial conversation, looking at a strategic partnership that can look into all of this and take the work forward. Because I think often we can be accused of talking a lot, and we're talking and listening tonight, but I think this is really about action, and I want us all to be convinced that there is a plan to do stuff with all of this rich information that we're gathering. Did you want to talk a little bit about the national and regional context for us?
Because I'd like to hear from our panel, and I'm really keen to get questions from everybody here. But as we think about how we connect regionally and nationally, the reality is that we won't be able to do this on our own. And if we are mobilizing across the borough, and if we're engaging partnerships across the borough, I think it's essential that we hear from national partners, that we link into national initiatives, but also that we're also linked in within and across London as well, so that as we're learning, we're sharing, and we're also learning from other boroughs, other parts of the country that are doing exciting work in this area. So I think that partnership, that learning as we're doing and sharing as we're doing will be important. I think it's also going to be important for us to connect regionally and nationally for the sustainability of our work. Because if there are efficiencies to be gained by doing things together and at scale across geographies, while having a focus and excitement in Southwark, I think we should aim for that as well. So, thank you, Rebecca. And with that, I'm going to hand back to our chair to get us to the next phase.
Thank you very much. That was beautifully choreographed. Thank you both. Thank you. Actually, do you want to sit here, Rebecca? Yeah, that'd be great. Do you want to just adjust the slides so we can see where we are? Remind me that I need to stay to time. So I'm going to challenge my panel here. I mean, it's heartbreaking because we've invited these people, and of course it's not a representative group of the huge amount of work that's going on in Southwark, but we took a leap and invited some people to come along, show some contrasting kind of ways of working. So talking of best practice and case studies, I was going to ask you to introduce yourselves, you guys, in a minute. But I'm going to challenge you to really go for the headlines of what you're doing. And by doing that, you're going to excite people so much to come and find out more about your work, because we do need to allow a little bit of time at the end. We've got to be out by 8:30. So sorry to push you, and you're all from extraordinary organisations that speak powerfully in all sorts of ways. So let's kick off with Mandeep.
Mandeep unfortunately couldn't be here today.
Oh, sorry, not Mandeep.
Yeah.
Mao.
Yeah,
so Mandeep hasn't come. Yeah.
Yeah. Hi everyone. My name is Mao. I am an artist, an aspiring psychiatrist, and most recently a very, very junior doctor. I'm in my last days of living in Southwark. I've just moved to Ipswich to take up my foundation post. And part of what I do in Arts and Health is I'm one of the member of the Board of Trustees of the London Arts and Health Forum. And I also started the King's Health and Humanities Society together with Mandeep and a few other friends. I guess my challenge today, we've talked about equitable partnerships, about respecting the arts and voluntary sector. And I guess my challenge is how do you sow the seeds of more equitable partnerships so that there are more health professionals, regardless of in whatever sector, who are more, ready to engage with the arts in terms of ideas, in terms of ways of thinking, in terms of respect, and so that there are more people like, Kevin and perhaps me and various clinicians around the room that I recognize from working in arts and health as well.
Thank you. And Jane, from Dulwich Picture Gallery.
Hello everyone, my name's Jane Finlay. I'm Head of Learning and Audience Development at Dulwich Picture Gallery. I've been at the gallery for around 2.5 years, but I'd say we've had quite a long history of looking at arts and health, and particularly around social prescribing. But for me, what I'm seeing is, whereas our programs have been really focused on particular strands, that we're looking more and more holistically at health and well-being, really across all our learning programs and all our kind of audience work. So from framing our activities around the 5 ways of well-being, through to how we evaluate, through to how we're working with health inclusion teams through our art programs. I just wanted to highlight 3 different types of projects that we've been working on, just to kind of give an example of those different ways. So one was around working with young people around the 5 ways of well-being. We worked with them to create 5 different films, all about how you can use art collections, specifically our collection, but how you could take that as use any collection to engage and to support young people around their own mental health and well-being. And those videos are out on our social channels, they're out on our website, and we've been sharing them as part of Health and Culture Wellbeing Week, which has been great. Another programme is working with Linkage Southwark. So we work a lot around, as I said, it's quite a range, a big spectrum that we're working with, from kind of health and wellbeing through to kind of diagnosed people with specific diagnosis. So we've been working around with the dementia team at Linkage Southwark. We're working on a new project called Network, which is around training their befrienders who work specifically with people with living with dementia to use art and health and creativity to support them in having positive experiences together, and also to help them to use and access not only our gallery but galleries in their local area as well. So really building capacity within the local area. And we've been working with Linkage for a long time, so it's been a really nice progression of that project. And we hope that we have created in a model that we can also replicate in different places too. And then finally, Together Through Art, which is we work very closely with SLAM, and particularly their Recovery College, hosting workshops, but we've been working with them on a project recently called Together Through Art, where we've been training 5 older people with lived experience of mental health as creative facilitators, and they've delivered programs across a whole range of activities, from young people and families through to older people, around how the arts can help to improve health and well-being. And that's really just something that's threading through all our work, and it's really reducing the stigma around mental health and showing it as a strength, and also supporting other people as well to kind of have that conversation and to open that up through meaningful interactions with art. So we do lots of different things, everything in partnership, is all we've been speaking about here. So I think it's like holistic partnerships are all really words that we're really supportive of. And I'm just really excited about this opportunity. I think it's got so much potential to give us agency to work more closely with health partners. We're very close to lots of different hospitals, so allowing us to kind of cement those partnerships. Also to knit together all the things we're doing. There's so much work going on in our borough, but how did those things join up? How can we kind of create that really strong network that supports healthier and happier communities? And I think for all of us, funding is the key issue, resource, and how can we best work together to share that and share our expertise and resources. So thank you.
Thank you so much, Jane. Yeah. Talking about joining up and coordinating work. So all these organisations and individuals are great partnership workers, and that's why they're here, because what we're trying to do is create momentum, critical mass, join up our resources so that we can pool all of that together. So Nora Maddock, Managing Director, Mental Fight Club and Dragon Cafe, which many of you people will know on Borough High Street in the crypt of St George's Church, which is a magnificent place.
Hello everyone, it's great to be here this evening. Thank you, Nikki and Will, for the invitation. So I work for a local small arts and mental health charity, and I thought I'd focus in on the importance of spaces today, because spaces are a critical part of how we work. We wouldn't exist without local spaces. We don't have our own office, so we pop up in a number of places. Most well known for the Dragon Cafe, which pops up in the crypt of St George the Martyr Church, which is just opposite Borough Station. And the Dragon Cafe is all about creating a sense of community. It's open to everyone. There isn't a referral system. You can just come as you are. And that is the most important part of it. You can sit on a beanbag, or you can be in a singing group, or you can do some Tai Chi, or you can just have a nice, nourishing meal. And we've also been lucky enough to collaborate with a number of other local organisations. For example, the John Harvard Library is next door to us, which is great because we can use it as an office space as well. And they've been wonderful for us. They provide us with training rooms, and the archive team are currently doing a project with our patrons of the cafe. We also collaborate with another library, not in Southwark, but in the City of London. But it just the library project in the City of London has actually really helped us in terms of the sustainability of our organisation, and that's funded through the City of London Corporation. And I think it's a really good example of a partnership that has grown into something really significant for us as a small charity. And we've also received a lot of support from Shakespeare's Globe, and I just wanted to mention a CD that has come out. So this is from our singing group, and Nikki was very involved in supporting this project. But it's an example of a CD that has emerged from a group of singers, many of whom had never been in a singing group before. Some of the members of the group were unable to speak due to various health conditions, and now they're doing songwriting together. And the Globe has been a key part of that process because the generosity of the Globe, they provided a platform for that singing group. Their concert for winter was a real inspiration for the group, and so thank you if anyone from the Globe is here. But that really inspired the group, and built their confidence, and then from those performances they then continued to write their own songs. So again, another example of a partnership that wasn't a formal partnership written in contracts, but was a platform and a space where members of our community were able to go and enjoy themselves. I'm trying to stay on track here. So I think they were the main things. In the future, what we're trying to do more of now is we're trying to collaborate more closely with, we collaborate with health professionals and also with researchers. So in the autumn, we're launching a new programme of work where we're providing opportunities for artists with lived experience of distress with the mental health care system to lead programmes of work involving collaboration with researchers, health professionals and others. So if anyone wants to find out more, please let me know. And please come and visit the cafe. We're closed in August, but we're open again in September, so you're very welcome to come anytime.
Thank you, Mary. Thank you. If you haven't visited the Dragon Cafe, other than in August, please do so, because it really is an amazing place. It's an inclusive space. The food is absolutely amazing. The creative activity, the high quality of the lectures, it's just unbelievable. Open on Mondays. And I'm glad you mentioned the city initiative, because to create another cafe and a library in the middle of the city and looking at mental health in the city is an extraordinary thing to do. Jill Henderson, Cultural and Communities Partnerships Manager, London College of Communication.
Okay,
Jill.
Hi, I must be doing something right because we're already doing partnerships with about 2/3 of the panel, so that's pretty good. Okay. When Will asked me to speak, what he asked me to do is talk in more broad terms about how a university, particularly a creative university, could be part of the partnership and why we want to be part of the partnership. We do a number of different projects working with both voluntary organisations and local authorities around areas of arts and health. And they range from what we call student-sponsored projects, where our students work on a project or a brief or a commission, right down to we have academics who are researching areas like the way that immersive technologies like VR can help with certain mental health conditions. So there's a huge amount happening. But this partnership offers up real opportunities for us. For those that don't know about London College of Communication, we've got 3 schools, Screen, Media, Design, which do what they say on the box. They teach people to be creative in those areas, and we have nearly 5,000 students. We're based at the Elephant. We've been based at the Elephant for a very long time, so we're very much embedded into Southwark, and that's really important for us. One of the things that we've been doing with our students, which has been really interesting, which I think is something that I'd like to explore this partnership, is where our students have gone to work on what everybody now is calling these wicked problems, where they've used design thinking and the creative skills that they have to work with communities and professionals on basically thinking outside that box, thinking in a way that starts to think around the problem and find real ways of working with that. We've got our sister college, Central St Martin's, up at King's Cross, have something called the Public Collaboration Lab, and they've done a range of different projects with Camden. And it's not just been your kind of traditional design or creative project, it's been around problem solving. And I think that is something that could be really useful within the partnership. So we do lots of projects. What's in it for us? Okay, why would we do this? Okay, apart from just being really nice people. Basically, there's a lot of evidence that for students working with real people on real issues, on real commissions, is one of the most important educational benefits they can have. And working with real people who have real problems that they can help with or be involved with and they can learn from is an even more of an educational benefit to them. The students love getting out and working with people, and I think that's really important for them, both in their growth as people as well as professionals. Another reason that we want to do this is that we have young people and we have staff who have health and well-being issues themselves. The incidence of mental health among students, particularly in London, is horrifyingly high. And although we have student counsellors, we can learn a lot by being involved with people who are working outside the university environment. There's a big problem with loneliness among students. So we're sharing the same problems that you're talking about internally, and it will help us massively to be involved in this initiative. And finally, I guess, two things. First of all, the college and myself have a passion for the local. I've lived in Southwark for a ridiculous amount of time. I'm really always amazed by how much happens here, but how much more could happen if we worked maybe more closely together. And finally, this has come up several times. One of my big frustrations is we do some fantastic projects with some fantastic people. It's lovely, it lasts 3 months, it's over. There's very little chance for us to follow up, there's very little sustainability. And what I'm hoping is through this partnership that we can find routes to sustainability to build those kind of more durational relationships that I think you really need to start really delving into deep problems and issues. We're building up a great partnership with Dulwich Picture Gallery. I did a very small project with Dragon Cafe a while ago, and I'd love to do some more of that. So basically, we're open for this partnership, and to be really honest with you, and I'll probably get sacked for saying this, higher education institutions have a lot more resources than a lot of arts organisations do. And you know, we need to be there putting ourselves out there and supporting that through our people, through our technologies, through our spaces. So thank you. Thanks for inviting us.
Okay, thank you very much. That was amazing. That was a lightning tour through that. Thank you. But Mal, you were incredibly modest with your introduction, and I know that you led some of the really interesting arts, health and well-being, and was it medical humanities, health humanities, clinical humanities? They keep changing the terminology at King's, and you were a medical student. Would you just like to say another couple of words, because I have a particular passion for making sure that our medical students are fully involved in this work, and I've got a Science Gallery colleague here, John O'Shea. Do you want to just stick your paw in the air, John, because John's the key programmer at the Science Gallery doing amazing work, and John and I are going to be working to put together a symposium on social prescribing, bringing GPs and medical students together. So Mal, the floor's yours just for a couple of minutes, but just say something else about what you do, because you were an amazing light within King's.
Nikki, thanks so much. That's very, very kind of you. Yeah, I was trying to be super concise, so I realized that, I haven't said half the things. But I guess, when I started Society, it was because I really found a kind of a spark when I realized that arts and health overlap so much, especially with regards to mental health, and I think that really changed my trajectory in terms of wanting to be a psychiatrist and what kind of psychiatrist I want to be. And I think the same goes with Mandeep as well. It's a pity that he couldn't be here today. And I think because of that, we wanted to set up the Health and Humanities Society, purposely doing it very broad, health encompassing any sector, humanities encompassing anything from arts to anything outside the box, really. And we wanted to bring out the same spark in our fellow students as well. And we were mindful we're going to get a niche, small community, but it's going to be a buzzing community. It's going to be very dynamic. And that's what, it's been running for 3-4 years now, and I hope it keeps running a lot more. And, I just want to pick up on what you said, Jill, because I really agree that when students go out and work with real people, it's an amazing learning opportunity. Apart from the various events and symposiums that we've run to try and kind of spark that broader thinking amongst my fellow students, I want to highlight one thing which we didn't actually do, but in a way we catalyzed. We managed to bring together the general practice department, someone from the dental school, and someone from the English department to actually create a clinical humanities program for second-year students in GP placements. So the way it works is that some of these students from each group will be invited to participate in a facilitated group discussion with artists, and some of our committee members were involved in teaching and facilitating as well. And what they've produced have been really moving works designed at maybe improving the impact of the GP practice, or in understanding more about the experience of the people that they meet in those GP practices as well. So things like photo series, poetry, art exhibitions within the GP waiting room. I think these are all very small examples of arts and health, nothing to the scale of what real kind of like big arts organizations, people with formal art training can do. But I think this is a small snippet of what is possible if you engage health professionals in this conversation, and not just health professionals, but sowing the seeds from much earlier on, junior doctors in training, medical students, or even bringing it back even further, young people in school and who are passionate about the arts and thinking, I'm passionate about the arts, I can be a doctor as well, this is kind of my way in, this is my thing that I'm going to do. So again, my call is to kind of challenge, how do you sow the seeds of partnership much earlier? Thank you.
And thank you. I'm glad we fitted that in, because that's really heartwarming and it's such an important perspective. We've got to sort of get in very early with you, and you have so much to offer us. So we have a little bit of time now before we wrap up. Michelle.
Thank you. Yeah, I'd like to say some things. Firstly, that it's brilliant that this has come together. For those of you who know me, probably 90% of people in this room know me. I founded Cool Town Arts from nothing, and it ran for 25 years, and we won the GSK Impact Award Prize. I'm not going to talk about what happened, but unfortunately some people took it over and it went bust. I have a wealth of knowledge which is wasted. And also I think it would be really great if Southwark would fund us to do the archive of it, because we had the largest number of people paid for on personal budgets to do art. We had a 25,000 reach. We were national and international, so we worked with people around the world as well. And I think what happened to it, the history of it and the legacy needs to be defined. But what I'm really upset about tonight is I haven't seen service users. Me, not only did I found an organisation, not only am I a trained artist, I'm also a service user. We need peer support and co-production. And at the moment, I'm working with National Mind to do a creative peer support celebration at the end of the year. And I think this is, how about having somebody with Parkinson's actually on the panel, saying what helps them, why it helps them. And I felt really disappointed all evening about that element not being in the room. And the organisation, Cool Town, was run by disabled people, for disabled people, who were themselves artists, who were themselves, and I think sometimes that gets lost. People need their contribution to be on an equal footing.
Thank you. It's always good to have a challenge. We can't be here being cosy and self-congratulatory, and we're aware that the service user voice will be very important, central to this work, and we've already started to speak to the council about how we do that meaningfully, because the other thing is not to do it in a token way. But Richard, did you want to say something on that?
I just wanted to say briefly on that. I think the voice of lived experience is really, really important, and one of the things we want to do is work with the network that's been set up around, called LENS, the Lived Experience Network, so that we do keep that in the decision making and thinking about this. I'm one of the organisations I work with is Heart and Soul, basically currently running the Welcome Hub, and they're a fine example of how you get the lived experience in on the board level, in talking to fundraisers and all the rest of it. So I'm sure that will develop as the project continues. Very good points.
Alex mentioned that lens, did you want to have a quick word? Yeah. If you can keep your questions or comments quite tight now so that we can get a number of voices.
Just responding to Mao, and Veronica Franklin Gould of Arts for Dementia, and we are setting up a series of pilots, social prescribing pilots for dementia, Arts for Dementia, but also supported by the very thing you've all been talking about, medical students. I can't wait to come to your conference, who will, and it is so very important, because if a medical student can accompany a person with an individual with early stage dementia to enable them to access their social prescription, the student will have a deeper understanding of the condition, of the challenges people face when dementia is beginning, but also their existing skills. And when they come to a weekly program, they can then find out about everybody else's, a deeper understanding of everybody else's types of dementia. And then that can actually feed into their education, so they can write a dissertation on it. And so that is my plan. So if anybody's wanting to work with dementia, early stage, on diagnosis, social prescribing, do come to me. And then finally, to say if you are involved with sending people to Arts Opportunities for Dementia, the Arts for Dementia website, free of course, is set up to signpost what link workers and families and need Arts Opportunities for Dementia nationwide. But locally, because if I post.
Thank you. We'll be staying in touch with you for sure.
Alan Palmer, Step Ahead. We're part of the Southwark Works network as well. I just want to talk about the end, when everything's been wonderfully successful. Michelle, whatever else she did, also got a lot of people into work, because while we totally accept the culture, health and well-being link, we also know that health and employment link. And what worries me sometimes is the more engagement we get in culture, whether that's through music, radio, arts, galleries, creative writing, whatever, we start setting up an aspiration for people which we then can't find jobs for them to go into. So whether it's a question or whether it's just a plea, that one line of the Southwark, because don't care about anybody else really, and that's from a Manc, terrible thing to say, whether there should be one line in there about linking it back, if we can, into employment as a wider health issue.
I'm so glad you picked up on that, because there's a pilot happening in Southwark, which I'm sure Southwark Council know more about than I do, but I've connected with the people recently. So there's somebody called Matthew Pike who's been seconded to Healthy London Partnership from the Department of Work and Pensions, and they're looking specifically around health and employment, and we've linked up with them as part of this work to say, well, if you're working in Southwark and we're working in Southwark and we've got mutual coinciding interests here, why don't we get together and talk about employability and all those kind of things. And with the new healths, these integrated hubs, health centres beginning to emerge, one of which is in Dulwich, and I know about that because I live there, which are going to be far-reaching organisations, and how might that agenda sort of play in through that. Any other questions to any of the panel, or anybody really, or a comment?
Was wondering, because I work for a charity and I support people who are at risk to be homeless in the mental health department. But I've been struggling to find opportunities for them to take part in art workshops. And I don't know if you have any projects coming out for homeless people that they can actually take part on.
They can come to the Dragon Cafe. They're very welcome. We have got people who come in who are homeless and take part in workshops, and they're very welcome to come in. They don't need to come in with a referral or a support worker. They can come as they are.
We can.
Is there someone over there? Yeah, sorry, I missed you.
Hello, my name's Hannah Chamberlain. My enterprise is Mental Health Artists, and we are a sort of hashtag and a movement around the practice of good mental health as an art. And we write labels at the beginning of the sessions where we write our names and hashtag artists, and it's all about changing the definition. The question that I've got, or the identity of the people in the room, the question that I've got is, how on earth can we find spaces in which to meet? And how on earth can we make kind of ways to meet for a voluntary group or for a low-paid group, something that we can collaborate on? Because we're meeting in Southwark and we're meeting in a park at the moment, but it's autumn. Coming up soon. So that's a plea as an individual group, but I'm sure there must be other groups who have the same issue.
Kevin, is that something we can take on board?
Definitely, it's something that we would like to take forward as part of this initiative, and to think about how we use the spaces that we have available in Southwark much more efficiently, and to see if there are opportunities for opening them up in a managed way to our local communities. So really good to have that feedback, and we'll take that away.
Then we're going to have to wrap up, because otherwise we'll turn other things on.
My name's Pip Helson and I work in Kevin's area, but I just wanted to very quickly mention that I'm transport policy, but we're part of a team creating space. Along the Old Kent Road, there will be a linear park. Most of the developments are coming with community space in them. There's a lot of art space coming. So watch this space and join with what we're going to create. Fair enough, it's going to take a while, but we are definitely including all those ideas in how we're developing our regeneration in these key areas. And community space is key to that, and being able to use it very economically, as well as having the spaces for the artists to have studios and things, plus the outdoor space for everybody to move peacefully around a very, very busy road. And we will be surely looking for art projects and performance to happen in that space.
Well, there's a lot of emphasis on space, and quite rightly, because without healing spaces and inspiring spaces, I think personally, I think it's a bit of a non-starter, but I know that everybody's very alert to that. I'm really sorry, but we're going to have to wrap up.
No, just one thing about space. So I was escorting somebody.
Oh, right,
so I wasn't
yes.
in the room. Somebody asked about places for communities to meet. Tate Exchange sort of functions as that. So we're always interested in hosting meetings like this, or other community meetings. But down on the ground floor of the Turbine Hall, you'll see where the Claw Studio corridor was, something now that's been called a Claw Hub, and that is being set up as a community space. So that could be there for any particular use. Could be for meetings, could be for a reading group, could be anything. And there's Ruby Maddox, who is in charge of programming that and running the calendar for that. Any questions about that? The space is going to be open in a month or so. We're just doing the refurb at the moment. Just get in touch with me and I can send you in that direction. Obviously, once it's launched, we'll do a much bigger, more public push on it as well.
Thank you, Carl. That's a fantastic offer. So please take them up on that, and also through us through this work. So just very quickly, because I want to leave the last minute to Kevin Fenton to wrap up. Can I just say the next steps are then that we're planning to hold another meeting in September. Most people are on holiday and doing all sorts of things, so Will, Helen and I and others with Southwark Council will be busy doing our desk research, finding out all the things that we don't know about. Please contact us if you have ideas or want to be part of this partnership as it begins to evolve. Eventually we'll get to December when we'll launch the partnership, and that partnership, as I said earlier, will take a programme forward which will have influence over a 5-year period, so that's really something quite special. I want to say thank you to all our speakers that have taken part. I think this is a beautiful room to be in. Thank you for coming, and we look forward to seeing you and speaking with you very soon, and I'm just going to hand over to Kevin.
So I'd like to add my thanks as well, and I've been asked to give my 5 takeaways from the evening. Number 1, How do we maximize opportunities which are in our grasp now? So we heard about social prescribing, the changes in the NHS, the movement between integration of health and social care. There are opportunities. How do we maximize them here in the borough, and how do we do it together? Second, how do we focus beyond health, but to think about well-being and to really look at physical health, physical well-being, emotional well-being, mental well-being, and I'd argue spiritual and emotional well-being as well, and linking the arts and culture to that. So we have an initiative which is both comprehensive, but which is also deep, engaging with individuals and communities in deep and meaningful ways. Third, how do we act at pace and at scale? At pace and at scale. So there was a lot of discussion today about doing things differently, doing things to have a different outcome, but also thinking about the opportunities for doing this at scale. Fourthly, a huge theme for the evening on partnerships, and how do we leverage partnerships, how do we work differently, and how do we think about co-production, and to start as we intend to continue with our communities. And then finally, as we depart, to think about sustainability. We want this not to be a short-term action, but to be here for the medium and long term. And we want Southwark to lead nationally, because we're doing things differently and we're having different outcomes. And those outcomes are affecting this generation and generations to come. So have a great evening, my 5 takeaways, and I look forward to seeing you in the run-up to our launch in December.